Hi everybody. This movement is going to be the foot tap sequence. So in this one you're going to be doing some coordinated hip movements. Try to work on your internal and external rotation of your femurs. You're going to be balancing on one leg, so if that's a problem I will show some modifications later on that you can do to kind of take care of that. So abs are going to be engaged, glutes are going to be engaged, you're going to be up nice and tall, trying to not let your pelvis shift. You're going to have your hands relaxed, and then it's up, and you're trying to touch your hand with your ankle. And then you go behind you to touch, and then behind you with the other leg. So it's rotating outwards, bringing that foot up. And then out to the side and touch, and out to the side and touch. So forwards, right, and well, both legs backwards, both legs, and then out to the side with both legs. The goal here is to try to minimize hip movement as much as possible, so you really have to rotate through your leg, through your femur. So keeping the abs tight, keeping your hips slightly pushed forward so your glutes stay nice and engaged. If you're struggling with the coordination or the balance on that, you can come over to a wall. Gently contact the wall, so you don't want to be leaning into it. You want to just have that contact there, and then you're going to do opposite, and then the outside touch. So it's the front and the back, and then the outside touch. The goal there is to work on keeping your balance as much as possible on that leg you're standing on. So in this case here, your knees bent, glutes are engaged, and when you transfer, keep that knee bent so you don't lock out. And again, light pressure on the wall. You want to be really trying to control the up and down, front to back, and twisting of your pelvis, because that's how you work on the hip, control the hip musculature that we're trying to get at. If you're feeling more comfortable with it, you can go faster, but you want to make sure that each time you're alternating your foot patterns, so it's one leg and then the other leg each time. But I would advise starting slowly, building up, getting that ability to rotate without shifting too much, because if you get into going fast and then you start moving around too much, you're just going to use your spine to do it instead of using the hip musculature. So try it out. Don't get frustrated. It's a pretty complicated skill, so give yourself time to learn it, and don't rush. Have fun.